Well, good morning and good afternoon, everyone. It's my pleasure to welcome all of you to this webinar hosted by Boost Child and Youth Advocacy Centre. My name is Sara Austin. I'm the founder and CEO of Children First Canada, and it's my great pleasure to welcome you. My pronouns are she and her, and I'll say a bit more about myself and my organization in a moment. Before we get started, I want to start with a few housekeeping items. For participants who are listening in French, you can click on the floor at the bottom left of your screen and select French. To see and follow along with the PowerPoint presentation in English, you can click on the presentation on the top left of your screen. And to follow along with the presentation in French, you can download the French version of the presentation by clicking on Documents on the right-hand side. You can feel free to download the presentation in both English and French by clicking on Documents to the right-hand side as well. There will be a Q&A section at the tail end of our webinar, so please feel free to submit your questions. You can go to the toolbar on the right-hand side and click on Messaging, and then click on Participants and type in your question. And you can submit your questions at any time, and I'll look forward to answering them. And if we run out of time and I can't get to all the questions, I'll leave some information for how you can contact me and send me further questions or feedback. And lastly, if you're watching this webinar as a group, I encourage you to enter the number of participants in the group by clicking on messaging and then sharing the number of participants. So on that note, it's my pleasure to begin our time together. In the spirit of reconciliation, I want to acknowledge that we all live, work, and play on the traditional territories of many First Nations, Métis, and Inuit peoples. Today, I am in Calgary, Alberta, which is the traditional territories of the Blackfoot Confederacy, the Siksika, Kainai, and Piikani, the Tsuut'ina, the Iskia, and Nakoda Nations, the Métis Nation Region 3, and all people who make their homes in the Treaty 7 region of southern Alberta. We are all in different parts of the country and on different traditional territories, so I encourage you to take a moment to honor the land on which you stand. And if you don't know the traditional territory you're on, I encourage you to take the time to look into that. It's my pleasure to be invited to speak here today. Thank you to Pearl and the wonderful team at Boost for inviting me to come back. I know I had a chance to join you in the springtime, and I've had the pleasure of working with many of you and visiting your child advocacy centers across the country. And I want to start by saying thank you. Thank you for the incredible work that you folks do each and every day to protect children, to empower them, to keep them safe, and to help them be able to achieve their full potential. I know none of you do this work for the fame and fortune. You do this because you deeply believe in your heart that children deserve to be safe, secure, and to have the best opportunities in life. So thank you for the dedication and service that you provide to children and their families and our communities all across this country, particularly in this really tough year. 2020 has been a hard year for all Canadians, and especially for children. And you have seen that in a way that I think most Canadians don't get to see it. You see the really deep toll that children pay and the ways in which they have suffered in their homes, particularly during the lockdown. So I want to thank you for your service and for all that you do to keep kids and their families supported and safe. So with our presentation today, I've been invited to talk about the latest Raising Canada report. This is an annual report that Children First Canada produces on the state of children in Canada, to look at the health and well-being of kids over the past year, particularly in the ways in which the COVID-19 pandemic has impacted kids and their families on their physical and mental health, and opportunities for how we can harness data to have a greater impact on the lives of children in your community, in your province, and all across the country through the community and through this network that we have of the child advocacy centers. So as I'm just going to fiddle with the technology for a moment and make sure that I can figure this out. One of the things I wanted to start with was just this thought that I think we all share this belief, and we've done public polling. We think most Canadians share this value that kids deserve the best that we have to offer, in the best of times. But I think that's even more true in the times of hardship that we're currently facing, this current pandemic. That we need to really be thinking about the best interests of children in the scope of all of our work. And while a lot of decisions have been made in the pandemic around protecting all Canadians, but particularly thinking about the elderly as being highly vulnerable, we know through the work that we do at Children First Canada and the work that all of you are part of through child advocacy centers, that we need to really be thinking about how crises can impact children and can negatively impact their ability to not only survive, but thrive. So I'm going to start by looking at the impact of the crisis on children, particularly from a database perspective. What is the data telling us, and how can we use that data to really raise awareness amongst Canadians about the impact of this crisis on kids? How can we raise awareness amongst kids themselves and enable them to advocate for themselves? And also, how can we mobilize policymakers to make better decisions in the best interest of children? So as many of you know, Children First Canada produces an annual report called Raising Canada, looking at the top 10 threats to childhood. This is a report we've produced over the past 3 years. And this year we looked at the health and well-being of kids over the past year, but particularly, the report came out in September, and we looked at the impact of the pandemic in those first 6 months and how the lockdown in particular had negatively impacted children's health. And we did that in partnership with a number of really important partners. The report that we produce has been done in conjunction with the University of Calgary's O'Brien Institute for Public Health. They are a founding partner in the Raising Canada report. And we also this year partnered with the Alberta Child Health Research Institute. And those two research partners were really instrumental to helping produce that report. We also worked with Statistics Canada. They were amazing allies in this process. As many of you would know, the collection of data federally and provincially on the health and well-being of kids, particularly on issues like child abuse, can be really challenging. And so we were really pleased to work with Stats Canada in harnessing what data was publicly available, but also data that they had within their systems that they could harness from different government systems to be able to really bring to light the real challenges that kids are facing. We also worked with our Council of Champions, which includes the heads of many children's charities, children's hospitals, child research institutes, major corporations that invest in kids. And we were really delighted to work with Pearl and Karen at the time at Boost, as well as Leah and the folks at Treehouse, and to tap into the amazing network of thought leaders and experts across the country. We also worked with a new partner, CAMH, the Centre for Addiction and Mental Health in Ontario, particularly from the mental health perspective. So really trying to, I think that's something that's really a key part of our work at Children First Canada. We are not the experts in all things, but we bring together the key thought leaders and experts from across the country and help have greater impact by bringing these voices together to speak with a collective voice for children. So this year we looked at the top 10 threats. The top 10 threats essentially remained similar, to last year, but we, in many cases, reframed them, or the way in which they have been impacted has changed over the way in which an issue like mental health has significantly changed in the course of a year because of the pandemic. The research certainly showed that all of the top 10 threats to children are worsening or at risk of worsening as a result of the pandemic. And I'll say a little bit more about each of them in a moment. I think obviously one of the things that we continue to be gravely concerned about is just the overall health and well-being of kids in Canada. There are 8 million kids in Canada. They represent about a quarter of the population in Canada, and they do not enjoy a safe and healthy childhood. Even before the pandemic, children's health and well-being had been on the decline for over a decade. A decade ago, Canada was in 10th place for children's health and well-being amongst OECD countries. The latest UNICEF report, which came out in September, now places Canada in 30th out of 38 wealthy nations for children. So we've fallen from 10th to 30th place. So we've clearly been heading in the wrong direction for a decade, and our children are paying a heavy price for that. Some of the most salient statistics that continue to be true for kids in our country are that 1 in 3 Canadians reports having experienced abuse before the age of 15. I know that statistic would be familiar to most of you working at the CACs across the country, but it's shocking, I think, when most Canadians hear that statistic. Another salient fact is that 1 in 5 kids in Canada grows up in poverty. And we know the impact of adverse childhood experiences like abuse and poverty, and the impact that has on children's physical and mental health, their brain development, and that it not only impacts them as children, but it certainly will impede their lifelong outcomes without intervention. And of course, we remain gravely concerned about mental health of children, particularly around the new statistic that suicide is now the leading cause of death for children ages 10 to 14. This one really jumped out at me this year. Suicide has been a gravely concerning issue for mental health of children for many years, but to now see it as being a leading cause of death for children ages 10 to 14 is quite disturbing. I am, of course, an advocate for all kids in Canada, but I'm also the mom of a 10-year-old boy, and I think about my own son and his friends and his peers. And I also think about kids who are growing up in homes where there is, where there's issues of addiction or other aspects of mental health, where kids do not have access to the mental health supports they need to survive, let alone to thrive. So these are things that keep me up at night and keep me going every day, and I think it's probably true for many of you as well. We looked at the mental health of children this year and worked at harnessing data again through Stats Canada and through many other sources. One of the things that really stood out was around how children themselves describe their own mental health. There was crowdsourcing data from children and youth that showed that 57% said that their mental health was somewhat worse or much worse than it was prior to physical distancing. And one of the things that really stood out was a discrepancy between how children reported their mental health and how parents reported it. Parents were more likely to underestimate how poorly their children's mental health was. So parents I guess it speaks to the fact that there needs to be more open dialogue and frank conversations between children and their parents about the mental health struggles, and the need for us as parents to be checking in with our kids and ensuring that that our kids have access to other trusted adults so they can talk about their mental health with. And certainly that when they have mental health concerns, that they have access to trusted professionals who can support them. I think obviously one of the things that you folks are most concerned about are the stats around violence against children. This is one of the infographics that pulls together, some of the things that stood out most to us. One of the things that was really challenging for us when we produced this year's report was having key timely and accurate data that we could report on. We certainly know that during the pandemic there was many signs that abuse for children was getting worse. But we having national data to be able to report on that was really challenging. One of the things that we pointed to was some new data that came in from the province of Ontario that showed new information about the percentages of different types of abuse, showing that maltreatment and the most significant form of maltreatment for children in Canada, in the province of Ontario, is neglect, which was 58%, followed by physical abuse, 37%, exposure to intimate partner violence being 36%, and emotional maltreatment 33%, sexual abuse being 21%. There was also new data that came in from the Public Health Agency of Canada looking at traumatic brain injury for children, and that being a major cause of death for children under the age of 5. Again, probably not surprising to you folks, particularly when we know about the impact of traumatic brain injury within the context of child abuse and particularly within their family environment. One of the things also that stood out to us was looking at this even from a global perspective. The World Health Organization described child abuse as being the hidden crisis of the pandemic, that this was a significant issue, not only for kids in our province and our country, but all around the world. And the World Health Organization worked with many partners within the United Nations in the global context to really put these issues on the radar, and continues to do so. Many of our partners, like child welfare agencies, children's aid organizations, and many of you at the Child Advocacy Centers reported grave concerns around the child abuse statistics, particularly during the lockdown period. Many agencies reporting a decline of child abuse reports of 30 to 40%, which we all know doesn't mean that child abuse isn't happening. It just means that children aren't being seen by trusted adults outside of their home. And there was a general sense that when children returned to school in the fall, that we would see a big spike in reports. We have certainly heard that anecdotally from some of you, but we have not seen any research data on that. And so if any of you are seeing that from a data perspective or have seen research on the trends around child abuse reporting, not only during the lockdown, but with the return to school in the fall, would certainly welcome you to share that data, because we'd love to be able to report on that and to be able to use that both from an awareness raising perspective, but also particularly from a policy influence, and how do we harness that to influence public policies and advocate for our children provincially and federally. Another big issue that we saw in the report this year was the concern about the kids had about missing school. Many kids were concerned that they were missing school. Many reported that they did not enjoy the online virtual experience, and that continues to be the case with the virtual learning that many kids are experiencing throughout the fall and now the winter. Kids being concerned about not only losing class time and the impact to their literacy and numeracy skills, but also their ability to be prepared for to graduate, to go on to post-secondary education, and to be employed. Kids certainly shared that they were struggling in many ways, particularly facing isolation, but they also feeling like they were struggling. They didn't like the online experience and they felt unmotivated, and that continues to this data that we're reporting on here is during the lockdown, but this continues to be the case in the fall. What we're hearing from kids consistently throughout the second wave of the pandemic, and continuing in the weeks and months ahead. We know that there's been a huge impact of this crisis on children's right to education, and there's one of the real challenges around this has been the real patchwork of approaches, both from an education but also child welfare perspective, that in some provinces there has been a more robust approach around trying to keep kids in school and support them with their virtual learning, but in many cases, I would probably say the majority, there have been inadequate resources to support children's virtual learning and to keep them safe in the in-class school environment. And when you think about schools, we're not only talking about the right to education, which is obvious, we're of course thinking about schools as being a gateway to the protection of many other rights. We clearly have seen the impact of the school closures on issues like child abuse and the ability to support children's mental health. We need to think about schools, and that's why we've advocated so firmly to keep schools open and support children to be able to stay in school and in a safe way, because we know that it's so important to so many other aspects of their physical and mental health. One of the things that stood out to me in this year's report, for instance, was physical inactivity. Barely 5% of children met their daily physical activity guidelines during the pandemic. Barely 5% of kids. Think about not only how that impacts their physical health and their ability to deal with, just to stay fit and healthy, but it also impacts their mental health. And when we think about so many kids suffering from social isolation and then compounded with lack of physical inactivity, it's no surprise that children were suffering from depression and increased rates of anxiety and suicidal ideation during the lockdown, and continue to face that with the virtual learning experience this fall. We also know that the ability to keep schools open has not only impacted kids directly, but of course parents as well. Their ability to work, to keep their kids in childcare or in school, has impacted the ability of parents to meet to keep their jobs, to stay employed, and to be able to provide for their families' needs. So when we issued this report, we issued a clear call to action. We know what the problems are, but we also know what some of the solutions are that can really drive systemic change. And one of the things we called for have consistently called for is the appointment of a federal commissioner for children and youth, to have somebody independent in government leading the charge and holding our government accountable. Secondly, we called for a national strategy to tackle the top 10 threats to children, and particularly to look at the impact of the COVID-19 pandemic and to tackle these issues in a concerted way. And thirdly, we called for a children's budget. Again, we want to see our government being transparent in how they spend their resources and how that impacts the lives of children. So we issued this call to action in September. We've had an online petition, which you can still go on and sign. It's on our homepage of our website. And we've encouraged people to continue to spread the word on social media using the hashtags Raising Canada and Ring the Alarm. The report, of course, garnered a ton of media attention. It always does, gets national media attention because the data is really quite alarming to the average Canadian and disturbing. And Canadians, we know, care deeply about our children and are disturbed when they hear these findings. But we want to go beyond simply just making headlines. We want to be driving policy action. And so we were very pleased when the report came out to be invited to meet with Minister Hajdu, the Federal Minister for Health. Our Council of Champions, along with some members of our Youth Advisory Council, had the pleasure of meeting with Minister Hajdu the day that the report was released, sharing our findings with her, and very pleased to hear her acknowledge that these issues are issues of a matter of life and death for children, and then what the government does now or fails to do will shape the trajectory of children's lives for years to come. We have had great open dialogue with Minister Haidu and with Minister Hussein, the Minister for Families, Children and Social Development, with the Prime Minister's office, and many other important allies within the federal government. And we've been in many ways encouraged and pleased to see many of the actions they've been taking, and even the Prime Minister's willingness to speak directly to kids in his press conferences in a regular way. But we want to see beyond just the rhetoric. We want to see some tangible action and policy steps being taken. So on that note, we were very pleased that Senator Rosemary Moody introduced a bill first in June and then retabled it in October once Parliament resumed after it was prorogued, and has tabled a new bill to introduce a federal commissioner for children and youth. This has been something that's been debated and discussed for many decades, and so we are very pleased to see a bill on the books and moving its way through the Senate. We are actively advocating on this as we speak. We have been today busily following up with many senators trying to get this bill into the committee stage, which is a really important stage for it to move forward and move beyond from the Senate then into the House of Commons, where it would actually move forward and have the chance to become a bill. As many of you likely know, we are looking at the prospect of a spring election. And so really time is of the essence right now to get this bill passed before an election is called. So, would urge you in your advocacy work, whether it's in your professional role as a member of a child advocacy center or in a personal role as a parent or a citizen of Canada, call your contact members of the Senate and contact members of the House of Commons, your member of Parliament, and ask them to support this bill and ensure that it's passed in a timely way. So, I want to just touch, most of the research that I've touched on already was shared based on a report that we issued in September. We know a lot is changing and very quickly, and so just briefly we'll touch on a poll that we did this fall with Abacus data, looking at the impact of the return to school and its impact on children and their families. So we did this new poll with Abacus in October, early October, because we were certainly hearing from parents across the country and from kids themselves that the return to school had been a rocky road, that kids were struggling with the transition back to virtual and in-person learning, that the issue of the COVID restrictions and kids having to stay home if they had symptoms or being sent home from school and having to be picked up within an hour, and then going and standing in line for hours on end, waiting days for results, was impacting children. So we wanted to test the waters and see what was actually happening in a data-driven way. So we learned that 18% of Canadian parents had had to work from home because their child had been unable to go to school in recent weeks. While 18% may not sound like that many, it amounts to nearly 1 million parents having to miss work because their child was unable to go to school. That's a significant number of Canadians who were missing work. For some of us, missing a day of work, is inconvenient, but it's something that we can overcome. But for many parents, missing a day of work means a day of lost income. Potentially, we're not just talking just one day. Often it's many days, because kids were having to not only get tested, but then wait days and days, sometimes even over a week, sometimes 2 weeks to get their test results back. That's a lot of lost income for many families that can make a difference when it comes to keeping a roof over your head and food on the table. And of course, that has a huge ripple effect on the mental health of parents and of course on the mental health of children and their ability to keep their children safe in their home and protect them from abuse. We also learned that 13% of parents said that they had had a child sent home because of COVID-related symptoms. 83% said that they had had to get their child tested for COVID, and it had taken at least 1 day or more to get their test results back. About 600,000 parents, so over 500,000 parents, had had to quit their work or change where they worked because of childcare and schooling challenges. We've heard about the she session and the huge toll that this has impacted on women, particularly mothers, because of the childcare arrangements that they've had to make over the past 8 to 10 months. But clearly this is having a huge economic impact, and we know not only is it having an impact, it's having a huge stressor effect within the family environment and making many more children vulnerable to abuse within their family environment, whether it's exposure to intimate partner violence between parents or other adults in the home, or direct abuse against children, which is of course gravely concerning. We also have learned that 14% of parents have had a child who's been in a school that's had an outbreak, and we know that this has continued to impact children's ability to continue to learn this fall. It's impacted their ability to stay in school, but often, for instance, in the city of Calgary, just recent media reports were talking about anywhere between 100, some cases up to 800 children being in isolation and in one school at any given time, which is massively disruptive to children and to their families. So that's some of what we learned in that recent poll, and continues to point to the fact that our kids are being impacted in very serious ways that have both short and long-term implications. So we continue to look for new ways to advocate for children and to put these issues on the radar. And we were very pleased this fall to be approached by Statistics Canada to forge a new partnership to look at how do we continue to harness data to develop policy solutions to improve the lives of children. So this partnership was announced in November on National Child Day. We were hosting a national event and bringing children and youth together from across the country. We were delighted to have over 3,000 children joining us from coast to coast to coast. Many of you as adults also joined us. We were pleased to have many of the child advocacy centers participating. We featured Treehouse as one of our partners, and one of the young people who's played an active role in advocating for the Treehouse Center within her community. So very pleased to have the CACs as a part of the National Child Day celebrations, and to have some of you involved in this new partnership with Statistics Canada of how do we harness data to develop policy solutions for children. What we're doing and what the project essentially involves was a hackathon looking at how do we hack data to develop better policy solutions for children. So last week, over 3 days, we brought a really diverse group of leaders from across the country, Scan staff, but also researchers, frontline professionals from many different professions, from children's hospitals to many other frontline organizations, to hack solutions. Each of the people worked in small groups to come up with policy solutions and produce videos pitching their ideas. This week, we're going to be meeting with a group of our youth advisors to watch those videos, to hear the pitches, and then we'll be presenting the policy solutions to Stats Canada and to other federal and provincial leaders and bringing these policy ideas forward. Because we know right now that these decisions are being made around whether to keep kids in school. In the province of Alberta, for instance, just a couple of weeks ago, the Premier made a decision to shut down in-class learning for children in grades 7 to 12. And as of the Christmas break back in January, all children will be in virtual learning for at least 1 week, if not longer. And this is playing out across the province. Many provinces looking at the closures of schools as one way to contain the pandemic and the massive spread that is happening in many of our provinces right now. And these decisions are impacting kids in very grave ways. It's impacting kids, it's impacting their families, and we need to continue to find ways to advocate for them, and for policymakers to think about all the unintended consequences of school closures in particular on the lives of children. So we continue to advocate, and we look forward to continuing to work with many of you as we do that. So, as I come sort of to the tail end of my presentation, one of the things I want to really identify here, and where I'm eager to hear your questions, your feedback and advice, is, how do we take all of this and continue to drive forward and continue to advocate for our kids at municipal, provincial, and federal level? And one of the things that stands out to me is that it's been really challenging to report on the impact of this crisis when it comes to violence against children because of the real gaps around national, provincial, and local data. We continue to advocate very firmly with Stats Canada on this issue, and we are pleased that there is very strong leadership at Stats Canada to try and tackle this and work with us and with many of you to try and come up with better data collection and reporting. But that's one area where we continue to see real gaps, and so that's why periodically I've reached out to Pearl, and she's reached out to all of you saying, if you have data that you're seeing, even if it's just within one center, that can be really meaningful because it points to some of the trends that you're seeing across the country. And we're continuing to find ways that we can work with all of you to pull this data together and advocate more firmly with Canadian public and with our policymakers to make better decisions. Another real challenge about this is that there's no single source of truth. at the national level, there's no one place to go. I mean, there's certainly the hub for national child advocacy centers, but that's not widely known by the public. And so one of the things, for instance, during the pandemic, we wanted to really do more public awareness raising. I was doing lots of media, some of you were as well. There was no one place we could drive people to find more information about these issues, about, what are the signs of abuse, how to report it. At a national level, that just simply doesn't exist there, at least that I know about. And provincially, even sometimes that's even within a province, there's no single source of truth. And so we're identifying this as a gap, and we're eager to work with you, get your feedback and ideas. How do we make it more simple for Canadians to learn about the problem and to learn what they can do about it, whether you're a child or an adult? Where can you go to get help, and how can we make that easier for people to take action? One of the other things that I think really stood out to me was the need for a more coordinated advocacy response with clear messaging. Clear messaging that we can share with policymakers, whether it's at provincial or federal level. Clear messages that we can be sending out to parents themselves. What can they be doing? What should they be watching out for with their kids? I forgot to mention this earlier, but of course, one of the things we saw, particularly from a child abuse perspective, that was gravely concerning was the real rapid increase in reports of children being exploited online. Kids were spending so much time online, often unsupervised by adults, and that made them very vulnerable to abuse and exploitation online. And whether it was the Canadian government or the Centre for Child Protection in Manitoba reporting on some of these issues, we know that it was an issue, and yet it was really hard to really find consistent messaging that we could be sharing with parents across the country about what they could do to be watching out for their kids. We identified a gap around teacher resources and how teachers know what to do and how to, many teachers know what to do, and many actually do not know what to do and how to report child abuse. We've seen that through some of the work that's happened, for instance, with the Calgary Child and Youth Advocacy Centre, that there's need for better teacher awareness and teacher training. And some of you have been a part of doing that through your work. But this year we worked with a number of partners to produce a resource for teachers on how to identify children who are at risk when they're within the virtual learning experience, because it's one thing for a teacher to be identifying risk within a classroom environment with a child physically in their space. They can see them, they can see some of those physical symptoms within that physical classroom, but it's harder when they're virtual. And so we identified some tools and resources that teachers could use within the virtual learning experience. But there's clearly a lot more that we could be doing in this space, and that's an opportunity for future work. And lastly, one of the things we continued to be gravely concerned about was messaging that was actually directly reaching kids. It's one thing for us to raise awareness in media, but a lot of that doesn't actually trickle its way down to kids. So how can we get these messages out more creatively to kids? What are some tools we can use through schools and through other ways that children are communicating to be able to get these messages into kids' hands? So those are some of the gaps and opportunities, and last but not least, but I've mentioned already, we're looking at the very real prospect of a federal election in the springtime, and that means these issues again will be debated and discussed in public discourse. And so we at Children First Canada are looking at how do we make this issue of child abuse in particular, but the health and well-being of children more broadly, an issue that really matters to all Canadians, and where we look for federal leadership from all political parties. We think this is a nonpartisan issue, that this is something that all Canadians and all political leaders should be committed to. And so we're currently working with all the federal parties as they develop their political platforms, to think about what commitments they could be making to children, particularly from a child protection perspective, but also what do they need to do to enable children to live in healthy family environments, to stay healthy and safe. And we know that children's issues are often relegated to sort of back burner issues. The top issues, of course, are always going to be the economy, to some extent the environment. We've seen women's issues pop up, certainly in the last couple of election cycles. How do we make children's issues something that all Canadians are talking about when candidates come knocking on their door? How do we make it something that we hear, every person who's campaigning to be a member of Parliament talking about with their constituents, and how do we get something, firm commitments, meaningful commitments on the part of all political parties to tackle these issues, so that no matter who was elected, we have strong leadership in place and that all parties are willing to work together in the best interests of our children. So those are some of the real opportunity gaps and opportunities that we've identified at Children First Canada, but where we continue to look to you folks as the leading experts within the child advocacy centers across the country. All of you are frontline experts, do incredible work, and are seeing things that sometimes we don't see as we're not, Children First Canada is not a frontline agency. We're working really at the 10,000 foot level to advocate for children and to enable children to advocate for themselves. So I'm looking forward to hearing your feedback, your thoughts on how we harness data to be even more effective advocates for children. I'm ending here with this quote from Marian Wright Edelman, which says that the question is not whether we can afford to invest in children, it's whether we can afford not to. I think we all know this to be true, that it's not only the right thing to do to invest in the health and well-being of children, but it also makes good economic sense. And so we're continuing to find, how do we build a business case? How do we make it so hard for policymakers in particular to ignore these issues and to get these issues front and center? One of the ways that we have done this work, particularly in all of our work at Children First Canada, but particularly so in 2020, is to enable children themselves to advocate for themselves and for their peers. This year we launched the Young Canadians Parliament, which is a really exciting new program that enables any young Canadian under the age of 18 to join us each month, to learn about their rights, to talk about the ways in which COVID-19 has impacted their rights, and to work with their peers in tackling these issues. They've tackled really tough issues of food security, their mental health, protection from violence. They've talked about gender rights. They've had a special session on anti-Black racism. Now, these are kids, the youngest participants have been 6 and 7, the oldest have been 17 and 18, and to see these incredible kids who've never met each other before work together every month to tackle these really tough issues. And then they get the chance to be able to speak directly with members of Parliament, with ministers and with deputy ministers, with shadow critics, and to bring these issues forward to members of Parliament and to the Senate, to put them in the hot seat. The parliamentarians are not there to make speeches or make grand promises. They're there to answer questions from the children and to listen to their ideas and to take their recommendations and then to take action. So if you haven't yet learned about this program, I encourage you to share this information with kids in your programs and encourage them to take part, because it's a really powerful way for kids to be able to advocate for themselves and to be a part of meaningful change right now in the middle of a pandemic, let alone once we move out of this into better times. So, I think these are really, I've shared with you many pretty dire statistics, pretty tough stuff, but what gives me hope in the middle of all this are the kids themselves. What came out loud and clear in this year's Raising Canada report is that while the pandemic has hit kids hard, kids are incredibly resilient. And when supported by trusting, loving adults who have their best interests at their heart, kids can do amazing things. And we've certainly seen that in the Young Canadians Parliament, and I'm sure, and I know many of you see that through the course of your work with kids at the CACs across the country. So I want to end this presentation by saying thank you. Thank you for taking the time to listen to this today, and for the work that you do each and every day. For any of you who are interested in more information about this report or the work that we do at Children First Canada, I've posted our information there, and I'll pop it into the chat box in a moment, because I'm going to close my slides so that I can see your questions and comments, and look forward to hearing from you. So I'm going to stop sharing now so that I can begin to see your questions and comments. So go ahead and pop your questions into the chat box, and I will take them as they come. So I see a question here. If the teacher reports to child protection, are they safe? Are there safe houses if needed, maybe for children to be moved into, and child protection agencies overwhelmed with reporting? So this is a tough question to answer, because it really varies across the country in terms of what the child's what the intervention approach will look like. And we know that house visits have been challenging in this pandemic. That's been a real issue that we've heard from many of you about, is how to do home visits within the context of the pandemic, and restrictions that many of your agencies have placed on your ability to do this. But from what I understand, visits have still been pursued, sometimes in creative ways, to be able to allow for investigations to happen and child protection plans to be put in place. If always, excuse me, I think always the principle has been that kids are safest when they can stay at home, as long as there's a protection plan in place and an agency that can support that, support the protection plan to enable a child to stay in home. But where protection is not possible within the home environment, of course, children are removed and placed into foster care or kinship care. But it's hard to come up with a blanket answer for this because the situation has really varied across the country. And to the question of, are child protection agencies overwhelmed with reporting? Well, that's a question I'm going to throw back to all of you, and maybe you can pop some of your thoughts into the box here if you are seeing reports increasing. And particularly with kids returning to school, we'd like to hear from you, and maybe you can share some of that data with us right now while we're having this session. I see a question here from Jennifer at Alicia's Wish Child and Youth Advocacy Center. Hi, Jennifer. She was asking a question about student absences and need to be collected and follow up. Great question. We don't have an answer for you right now, but I'm going to make a note of this because it's obviously an important indicator about whether kids are showing up for school, whether it's virtually or in person, because it's we know for many kids the dropout from school or school absences is an indicator that something's not right in the home environment and where children could be at risk. So I'm going to make a note of this as being an area where we can look at some data collection, and is there data that we can be harnessing around this to be able to report on children being at risk locally. So that's a question that I see from Jennifer. I'm going to flip through to see if there's anything else. I'm not seeing any other excuse me, questions and comments posted at this time. I'm going to pause for a second, see if anybody else wants to pop some questions and comments in there. I'm going to turn to, I know Pearl's in the background. Pearl, are you seeing any other questions and comments, or maybe there are some questions and comments that have come in to you directly, because I know you're in regular contact with your peers across the country. Any other concerns or trends that you've been seeing? So Pearl, I don't know if you can either speak and pop in by unmuting yourself, or if you want to pop some questions or comments into the chat box, I'd be happy to respond. Not yet. Okay. Good. Well, I think that brings me to the end of my presentation time. I'm going to have a look and see if anything else is. Yes, some people are asking about the presentation. So the PDF is available under the documents. So if you click on the documents section, you'll be able to download the presentation in English and French. And then if you're looking for the main Raising Canada report, I will pop the link in there now. Give me 1 second. I'm going to pop this information in here so that you know how to find the report, but also how you can find me and contact us at Children First Canada. So there you go. That's the link to our website where you can find the Raising Canada report. You can also find out more about the recent Statistics Canada collaboration and the current project that we have going on with a hackathon in harnessing data for policy solutions for children. One thing I didn't touch on, but maybe I'll just mention briefly, we also did a recent report another national poll that we just released on National Child Day on children's awareness of their rights. And the report, we knew anecdotally that many children in Canada never learn that they have rights. The report confirmed that. I'm just going to pull up the report right now, but basically only half of kids in Canada have ever learned that they have rights. And about 75% do not know what to do with their rights are violated. Think about the vast majority of kids not knowing what to do if their rights are violated. The most concrete one that comes to mind, of course, I think for all of us, is the issue of child abuse and knowing what to do And we know that many kids simply don't know what to do or are afraid to take action if child abuse happens, and that the vast majority of children never report abuse happens, and even into adulthood, many adults never disclose the abuse that they experience as children. So this is, when you think about all the gaps around and opportunities that that lie in front of us, the opportunity to raise awareness of children that they have the right to live free from violence, the right to be protected from all forms of violence in their home and online and within their community and their school. There's obviously a significant opportunity for us to raise awareness of children about the right to protection from violence. And so, that's one of the things we'll be looking at Children First Canada for the year ahead, and how we can work with this national network of CACs to really tackle these issues in a concerted way. I'm just popping into the chat box to see if anything else has come through. I don't see anything here. I'm not seeing any other questions and comments. So on that note, we maybe will wrap up a little bit early and give you back a few minutes of your day. So I wanted to just take this time to thank all of you for being with us today to learn about the latest Raising Canada report and some of the new polling we've done during the COVID-19 pandemic on the impact of the return to school this fall, and the new polling about children's rights and their awareness. You can find all of those reports on our website. And as I said earlier, we're very eager to hear directly from you at the CACs, whatever agency you represent, if you're in child welfare or the police or working in the health systems, whatever your area of expertise is, we're always eager to hear from you. So don't hesitate to send us an email and reach out if you have questions and comments, if you have ideas for advocacy, if you have data that you want to share and be a part of advocating and sharing that data so that we can raise these issues collectively. So please reach out and be in touch. And I just want to end by saying thank you. Thank you so much for joining us again. Thank you, Pearl, and thank you to the Boost Child Youth Advocacy Centre for hosting these webinars and for inviting me to be a part of this. Just as I wrap up, I see one last question on vaccination trials. I'm just reading the question here. Does Children First Canada have a position on the issue of COVID-19 vaccination trials for children? Kids might need to wait until after the start of the next school year to get vaccination. Hi, Daniel. Nice to see you. Daniel and I work together at the Child and Youth Advocacy Centre Calgary, and he's now with the amazing team at Treehouse. Yes, we don't have a formal position on this yet, Daniel, but it is something that we actually are speaking about with medical experts. We, through our partnership with the Children's Hospitals and with Children's Healthcare Canada, this is an issue that we are, of course, gravely concerned about as advocates, let alone, I think, for many of us as parents, wanting our children to be vaccinated and for that to be done safely. So it's something that we are actively looking into, and where we hope to be able to share something more with you shortly. But yeah, it's a very important issue, because we know right now that for the vaccine trials that there have not been vaccination trials for children to date. I think Pfizer, just announced that they are starting trials with children ages 12 and over. But that begs the question of what's happening with the younger kiddos, and we know that that all of our kids deserve to stay healthy and safe. So this is an issue that we're looking at, and we will be looking forward to sharing some more information about that with you shortly. So I'll wrap up and give you back a few minutes of your day. Thank you, everybody, for being a part of this. Thank you for the amazing work that you're doing to keep kids and their families healthy and safe. And I want to say an early happy holiday greeting to all of you. I hope that you can all take some time over the holidays to rest, recoup, and enjoy being with your loved ones. And just to take care of yourself. This has been a tough year, and so I hope all of you can take care of yourselves and stay healthy and well. Thanks, everybody, and have a great afternoon. Take good care. Bye-bye.